a machine three times now, isn't it? The bioresonance. It's a machine from Germany that started in 1979. And I got on for about 3 hours. And I just wondered if you had any knowledge of this machine.
Yeah, a lot of those machines I'm familiar with as a naturopath. I had a clinic and lots of different machines came in and I experimented with different things. It really always comes down to, my opinion, is monitoring it and seeing, are you really seeing results? Is your body changing? Is your body getting affected in a positive way? That's where the monitoring comes in. You have to watch to see how long you've been on it, what the practitioner says you can expect to see the difference. But the monitors, don't lie. So your blood markers and your other tests. I don't like to use just one machine to test to see. I like to do different things to monitor how things work. Again, I'm retired. I'm not in practice. I'm just saying from my experience that when you use these different machines, whether it's to get the tumor to change, it's how are you seeing the difference in the long term. That's always what it comes down to.
This recommendation that we should have 5 a day vegetables, do you know what the average adult consumption is at the moment in the UK? 2.2. And do you know the average teenager? About 1.8. And there are many children under 5 who are in the 0 category. In Europe, they're already saying 10 portions of fruit and vegetables a day. And so we have a massive wake-up call on our hands. This is where my passion is really going now, is to try and because actually, we're heading towards a sort of perfect storm with the fact that we're aging, the fact that these lifestyle illnesses, or the World Health Organization calls it non-communicable diseases, NCDs. But we're not just looking at cancers, diabetes, obesity, and depression, and arthritis, and allergies, and all these things. So every one of us has, and I find that the environmental movement has got a voice. We all hear about green summits, but I think in the health world we're underpowered, because actually the planet will probably survive. It's the people that we have to actually think about, because it's not all right for us to all be living as if illness was normal.
I've been to hundreds and hundreds of conferences in 35 years, and I've sat where you guys have sat, and you have all this information in your head. A question to you guys, because I've spoken to many of you in different times. Do you know where to start when Monday comes? Do you know where to start when Monday comes? Do you know
Sunday.
What to do?
Well, when we're back in our lives.
Yeah, when you're back in your life and you have all this information. So my encouragement to you guys is to take a day, maybe 3 days, maybe even a week, and just sit and think about because all of us have said different things, and yet we're all saying the same thing. Okay, so which one is right for you? And then decide what will you do to take the first step. It only has to be one step. It doesn't have to be everything, right? So as you guys are asking us questions, it might be something, if you don't know where to start, because I saw some of you shaking your head, I don't know, I'm confused. Ask us, where would we say for you to start? And we might all come up with different questions or different answers, but it might resonate with you. Oh, that's a good idea, I might do that. Or that's a good idea, I might do it. Because each one of us have different personalities, each one of us has different experience, obviously. But which one is it right for you? So that might help.
I just actually wanted to thank you for this, actually, because we have heard a lot of conflicting information, and I just want to ask you to connect with that part of you, that inner healer that every single person has. And I was just actually running a little meeting just now, and I asked, what is it really that stops us from knowing? The one thing that stops us from knowing what to do next. And often, and people answer this correctly, often is not asking the right questions. We ask other people, we ask therapists and doctors, but the one person we miss out in this journey is us. What would feel the best for me? What do I need to do now? What's the next step? And of course, when we're asking from fear, the readout from the computer is scrambled. So the first thing would be to get rid of fear. However you're going to do it, there's lots of tools, EFT, and I have also created a tool for releasing fear. but get rid of the fear, connect with your heart, ask right questions, intelligent questions. What's the most important thing I need to do next to make sure that I will be healthy, that I'm healthy and well? Not that I will be, but that I am healthy and well. And then another thing that a lot of my clients find very useful, myself too, imagine that you go into the future. It may be only a month away, or it may be only a week away, or a few years away, where you see yourself completely healthy, energetic, fantastic, joyous, and you ask your future self, how did you get here? Ask these questions and write it down. Other people find it very useful writing. So you pretend that there is a wiser part of you inside you, and you say, hi yourself, wiser me, I have a question for you. What should I do next? What is the right supplement? And immediately reply to yourself. You can even use a different colored pen. So keep on writing, asking questions, and leave it on the side, come back to it next day, and you'll be surprised how much wisdom you find in these writings. I don't know if you agree. So one thing that I would like you to take away, there is a healer, there is a genius inside you, and just keep on tapping into it through silence, meditation, dancing, and keep on asking wise questions. Yeah. What if the cancer that I had, or do have, was the best opportunity for me right now? What was the most inspiring event in my life? What if it's an invitation to my greater being? And if that was the case, what I should do next? And write it down.
I need to see the practical, right, to how to actually do it. So I would take my notebook, because I know a lot of you guys have notebooks, and I would take out each speaker and all my notes, and I put it all out on the floor so I could see it. Right? That's how I do it. And I would see it, and I would, really look at it, and then I would write some things down, or I would talk to somebody, or I would talk to myself, take a walk, and say, is that the right one for me? And then I would hold and say, is this right for me right now? Yes or no? If it's yes, okay, what's the next step? You call that person, you make the step, and you start going in that direction. But for me, because I'm analytical and I have to see, the big picture, because so many people, when I work with them, are very analytical. They're like, well, do I do this way from morning till night, or do I do this system, and which supplements I take, and that's where the fears come in, and being anxious and all that stuff. So it's a matter of picking the person with the therapy and going with that as you lay everything out in front of you, or on a computer, however way you want to do it. Me, I put everything on. Literally, I've done this. My whole floor has been covered with paper as I look and see and walk it. Because there's something, like you said, there's something physical when you walk up to something or hold it, and you know that you know. But I was chatting with somebody, and we were talking about this earlier, that, when you're afraid and you have this health challenge that is what we consider life-threatening, you hardly could think about what is right for you right now, right? And you're just like, I don't know, just somebody grab me and tell me how to do this. I don't know, I want somebody to walk me through. And of course, conventional medicine, you go in the hospital, and that's exactly what they do. They walk you through, they say, oh, you've got chemo surgery, radiation, this is what we're going to do, and you don't really have to think. This is a thinking therapy. This is the one where you do have to. But the cool thing is that you have plenty of help, plenty of support. You just have to take that step in that direction, right? And it's just that one step. And taking that step is what empowers you. And when you're empowered, that's when the healing comes.
I would say that the first step is raising your energy, and to do that by learning to receive, giving yourself permission to receive energy through spiritual healing or Reiki or energy therapies, where you don't, for the time being, so much have to think so much as receive and raise your energy. Because as your energy, chi, vitality rises, so does your consciousness, so does your clarity. And that helps lift you out of fear to the point where things become easier, self-help becomes easier, and making decisions becomes easier. So I do totally agree with that sort of organising your thoughts. But everybody I've ever met has found that if you can lift yourself that first octave by receiving energy, then everything else gets easier.
I think I would be saying, be aware that you are part of the greater whole, and that dis-ease happens when we don't dance with the natural rhythms. And it's light that connects everything in the universe, and this part has been left out of nutrition, that the body nutritionally has to be prepared to actually store light, but equally now we know with the right nutrition and state of mind and being, the body will produce light. It has this process in place, and this enables us to be in touch with our own inner wisdom.
Perhaps Robin, if you wouldn't mind answering the same question. The question was, what would be the first thing one would do when they leave here on Monday? What's the first thing to put in place in your experience and things? Thank you, Barbara.
Well, I think I would follow up with what you just said, in as much as that I think that there's an enormous amount out there in terms of support in actually helping you to find out what to do. It's an enormously big deal to find out what to do, but there is a lot of support for it now. There are ways you can go forward, and but in amongst it, I think one of the things that's quite clear as soon as you come to a conference like this is that the amount of information that's out there is a big problem in a way, because it's not even congruent. It actually, there's lots of conflicting information. We've had it here in the last couple of days. And you've got to find your way through this. And the support you need to look for, I would say, is the support that actually feels right to you. You just need to make connections with people, and you say, well, look, this person I feel I can trust, and they have at their fingertips stuff that would take me months, maybe years to get, and they are my shortcut to helping me to find my way. And so this process of, it's intuition really, basically. You're going with your intuition, you're feeling for the people, for the information that just, well, okay, this feels good. It doesn't matter what anybody else says, it doesn't matter what the textbook says, it doesn't matter, this is actually my thing. And I think, very often it takes the form of actual people. You just come across somebody who actually, even though they may play a relatively small part in the practical journey you have, somehow they're going to help you to orientate yourself with what is right for you. And I think, I'm far from the first person who said this on this conference, but it's, this fact is not prescriptive in any way, this whole thing. It is, so much to do with the person themselves being behind what they're doing, that is really their response to their own situation. And anybody who's trying to ignore that as a practitioner is probably not the right practitioner for you.
Could I just add, so I know I'm not on the panel, but I am 7 years on from a cancer diagnosis, and I can tell you the one thing, I agree with everything that's being said, but the one best thing that I did for myself, the only thing you can do immediately is change what you're eating and drinking. That's however you start with that, it doesn't really matter. It doesn't have to be an exact science, but we've had enough information here to get the basics covered. But the best thing that I personally did, I allowed myself to take 2 or 3 weeks out without making any decisions to get used to the idea of having cancer, which you do, believe it or not. And then you're not thinking through fear anymore. Then you can just accept it for what it is, and you can start piece by piece looking at information, saying, I might want to look into that, or that doesn't really resonate with me at all, and gradually start to build your recovery program up for yourself. And I think just giving yourself time, unless you've been told it's a medical emergency, to give yourself a little bit of time to think about it before rushing out and panicking and thinking, oh, well, I've got to do this, I've got to do that, because God knows what would have ended up.
I just wanted to follow on from what has been said already here, which is very true. Intuition, right? So, one of the useful thing to know, and we all know it, but I just want to remind us, is that when something feels wrong, and the body says no, what do you find that you feel in your body? When you sort of consider something and the body goes, no, don't do it, what do you feel in your body? Contraction, and where? Yeah, for some people it's in the stomach, for some people it's everywhere, for some people it's in the jaw or chest. And when something is right and your body says, yeah, go for it, where do you feel it? And it's more like opening, right? So pay attention with small things, like, should I do this? Is it good for me? You know, when you're walking in a shop and you're deciding whether you should buy broccoli or cauliflower for dinner, test it on smaller things and notice how your body responds. Is it good for me? And if the answer is no, it's usually contracting, it's tensing up, and it feels like the energy drops. Yeah? And if something is yes, usually the energy expands, you're feeling more relaxed, and it's sort of more joyous. And we all know it, but we sometimes haven't paid enough attention to it to recognize it. So pay attention for your yes and no signals, because I'm more intuitive, and some people are more logical, and it's great to play with both of those things.
That's a great idea. I'm going to do that. Practice on broccoli. That's a great idea.
Many years back, Rosy introduced me to one of my favourite books to give people, to give them inspiration at the start of the journey, and that's Remarkable Recovery, which is out of print, and you get it for 1p on Amazon, but it's a nice research into, well, what is spontaneous remission. Now there's this kind of sequel, which has a very similar name, which is called Radical Remission, and it's just come out by a lady called Kelly. I can't remember her first name. Is she around, Kelly?
Kelly A. Turner.
Thank you, Kelly Turner.
Yes.
She's done research into what people who had remarkable recoveries actually did. So what were the things that were in common between the people who survived when they medically shouldn't have? And she's organised into chapters which cover each of these things. And intuition is one of the ones that was most common. The people said they followed their intuition. So anyway, that's why I thought of it. And it's well worth getting that book just to see, well, how did these people survive?
Fantastic. Well, on that note, and it did teach me a lot as a young holistic doctor trying to really understand this, because I got to Bristol and could see people getting well from the inside out, and it all seemed very deeply mysterious. But she, another thing that everything constellated around was belief. So it was people who believed in themselves, people who believed in their therapists or doctors, people who believed in a higher power and the possibility that they can heal through divine intervention or energetic divine matrix intervention, people who used practices that were to do with belief, like affirmation, visualization, being able to see themselselves well, and people who use belief-based therapies like hypnotherapy or NLP, reframing, matrix reimprinting, anything which, psychological kinesiology, any of the things which actually open that window of possibility for us for healing to occur. So, you know, this whole business of working with our minds and getting ourselves into a place of radical belief, or, you know, radical belief precedes radical remission.
How important do you think radiation from nuclear power stations is playing a part in the increased incidence of cancers?
I was just sharing this with somebody about this. I have a good friend who was in Chernobyl when the nuclear power plant went down. You guys familiar with that story? Yes? And she lost her whole family to the poisoning there. And she was there also, but she did not die. And she came to the US, she became a holistic practitioner, model, she was a beautiful woman. And I asked her, that's exactly what I asked her. I said, well, how did you guys deal with the radiation poisoning there? She said, well, what you need to know is that 65% of the people died not because of the radiation, but the fear that they were going to die from the radiation. 65%. I say, are you serious? Wow. And so that's been her life mission, is to help people understand this. And so then I said, you know, the practical part. Well, yeah, but what do I take for radiation poisoning if, you know, because of all this thing going on? And she said, apopectin. Apopectin is one of the easiest fastest ways to start pulling out the poisoning. And there's many things you could take. I mean, that's just one thing that she latched onto and she's formulated. But really it comes down to is there's poisoning all over the world all the time. I mean, the fish are toxic and this are toxic and that, but it's the fear that will affect you faster than the actual poisoning many times.
And we still shouldn't have nuclear power stations on this planet, in my humble opinion. The idea that actually that anybody could bury toxic waste on this planet and think that that's all right for future generations to find, to me, is absolutely abhorrent. And I've signed up to the Polly Higgins. Do you know about Polly Higgins?
Yes.
Who is a barrister who's taking the world on as her client and who's trying to get the fourth law for crimes against humanity of ecocide to hold companies a responsibility if they willfully actually are involved in creating mass destruction or crimes against nature, humanity, through such absolutely barbaric. There is plenty of energy on this planet. We are surrounded by energy. All we have to do is harness it and treat the earth respectfully. And having said that, I'm just minded of a motto and the messages of water, and what you're saying about fear. Our bodies are 80 to 90% water, and those beautiful experiments of this Japanese man, Emoto, showed that actually if we are pulling fear, anger, negativity into ourselves, then that affects our cellular functioning. I'm sure this is where Barbara's going with it. And conversely, so when there are natural disasters, I know in Japan, for example, there are healers working with putting different messages into the water and so forth. So yes, we can bounce back, but for goodness sake, let's say no to these things being there for our children and grandchildren.
I'm kind of in charge of my own case, and I have no one to overview it or anything. And as you say, there's so many stuff out there. So I've met a lady who has a source of GC-MAF. I'm taking lots of herbs mainly because I'm a herbalist, doing various nutritional supplements. And I've just started on Iscador injections from the London Hospital of Integrative Medicine. And I'm quite interested in pancreatic enzymes as well. And would like to know a source of those. But I'm wondering about contraindications with taking these three things and four things.
That's very personal and specific, and
but the whole thing of mixing and matching when we don't really know, nobody's overviewing.
First thing I would say is, and this would be to anybody, why are you doing this on your own? And that may be too personal a question to ask you in this context.
Well, I've been to various Nicola Henbury, Patricia Peat, and they all say it's great what you're doing.
Yeah. So you're not completely on your own.
But I haven't asked about those particular things, and I just sort of made it relevant if other people are thinking of combining those things. Maybe there's a definite no-no.
No, I don't see any contraindications. GMAF, the jury is still out. This is immunotherapy. Professor Angus Dalglish, who's Britain's only immuno-oncologist, at the moment is not convinced by the evidence. He's pushing us all towards low-dose naltrexone in preference to GMAF. The other two you mentioned were...
the Iscador. And also I've just heard that the drops are just as good as the injections.
Well, it's a different mechanism completely, and it depends on dose. And if you're having injections, that's subcutaneous, that's as an immunotherapy to try and excite your immune response. Whereas Iscador by drip is actually working as a cytotoxic, and it has different uses depending on the route. And if you're taking it in drop form, it's working more like a homeopathic.
Iscador is homeopathic, though, isn't it?
It's between homeopathic and herbal, really, because in the amounts you would have it in a drip, it's not homeopathic. But anyway, this is very specific, and I think I'd be happy to help. But I think the idea of polypharmacy, there is a risk that people will go and get 50 things, everything, and that isn't a way to go either. because you can actually A, become broke, and B, become toxic, and C, have things that are contraindicating. One, for example, is apricot kernels and resveratrol. You know, the way that the apricot kernels are working is actually destroying resveratrol. So you could be buying, you know, taking lots of apricot kernels and knocking out all your plant phytonutrients that you're taking. So there is, you know, there is need for a bit of guidance on those kinds of things.
Yeah, and I would go along with that, because I've been wanting to say this as you were talking, is you really have to have a team. You have to have a captain of the team, which would be like your primary position, but an alternative role would be somebody who is the one that you're working with for the whole program. But have a team of, you know, somebody who's supporting you emotionally, spiritually, having the support of a friend, having the other therapies, whether it's colonics or massage or whatever it is. But, you know, having this whole team of everybody knowing what everybody else is doing. Because when you have different practitioners and, you know, one is doing one thing, that's fine. But one person who is working with you, because you're the captain and they're the co-captain, would know everything to make sure nothing is contraindicated and to make sure that it's all working synergistically. Because there's many different levels, as you were saying, which is exactly right. But if you have a team, then it's much easier.
Can I just respond to what you just said, Judy? That's quite hard to do with the
I
NHS.
know.
With you know. I haven't said anything to my oncologist about the things I'm doing because I don't think they're interested, and I don't see the same oncologist every time I go to the hospital. I don't even have a
If you
regular.
have this team idea, if you have an integrative medicine, either doctor or nurse, in your anchor, and then you have somebody helping you with the emotional side, somebody for the energy support, somebody for the nutrition support, you know, that is a very good combination, and perhaps a spiritual healer.
Have you guys heard of the Cancer Battle Plan with Anne from? She was in the States. Anyway, she had her plan, her program of how she was going to start, what therapy she was interested in, what felt right, and she had split it all up. And then she would say to each of the people on her team, "This is what I'm doing, and I want to know if you approve or not." And if they approved, that was great. They were on the team. If not, it was done, right? I had people come to my clinic doing that. No kidding. I was like, that's smart. I like that. Because it makes it easier for the practitioner, of course, because it's like, okay, I want to do what makes you happy and what's going to bring you results, right? But you say, well, what I really want, you know, is somebody for my emotional healing, and I might not agree with it, but it's what you want. You're the team captain. So I'm like, okay, fine. You want somebody, in other words, who works with you and not, well, I don't know if that's going to work. I've never heard that word. That's not my thing. You don't want somebody like that, because that's negative, like she just said, right? You want people who are positive, who encourage you, and would say, well, maybe I don't know about that therapy you were talking about, but I'm going to go find out. Oh, I like that one. You want them on your team, right? So you want people who team, meaning they're open to what you're saying, they're nurturing, they're willing to help you. All of us are team players here. And I mean, people will come up to me and say, well, I don't know, but email me, I'll find somebody for you. And we all networkers, right? So that's what you want to do, is you ask us if you don't know, and we'll help you find something.
And we've been just told we've got 1 minute, and I want to say something really important, which is that efforts you make in any of these dimensions will help all of the others. So there isn't a code here, you know, there are multiple routes in. So if you work with your stress, it'll affect your energy. And if you work with your energy, it'll affect your consciousness. And if you work, you know, if your consciousness rises, you'll get clearer about your intuition. So any of these steps that you take will, you know, all these roads lead to Rome. One of my lovely doctor friends, a client said, he was trying to teach visualization, and she said, look, how does 20 minutes a day of thinking the right thing undo the other 23 hours and 40 minutes of total crap that goes through my brain all the time? And he thought about it and he said, it's like if a dog picks up a good smell on the wind, the rest has to follow.
Just quickly on your question, I mean, I feel very much yes, well, I'm no expert whatsoever medically. I would never advise anybody medically, but the one thing I have learned over the years is just how unbelievably complex the whole area is, and we can all use experts. I feel that's absolutely the story, and that if we don't, not only are we in danger of making some boo-boos and either wasting money, time, energy, whatever it is, all the stuff that's in short supply, but also we can completely miss a trick. You know, there's just stuff we never thought about, basically. And so to be out talking to experts as much as possible it makes complete sense to me.
It's always three things, and that heard everybody say that consistently, because you guys are saying, and I know Fiona said this morning, oh, it's so confusing, and everybody's contradicting, but really, it's not. Okay, listen, three things. Okay, number one is to build up the immune system. Agreed? Immune system, you have to build it up in some way, right? So many, many ways to do that, but immune system, right? Detoxification, you have to detox the emotion, you have to detox this, you have to detox that. So number two, so find a way to detox. Number three is the emotional spiritual part. That's the foundation, right? So we really are saying all the same thing, but we're approaching it differently. Nourishment. And well, that's part of the whole immune system. I look at that nutrition and immune system, right? So there's many parts to each, but it's immune, detox, emotions. That's simple. Keep it simple and find which one works for you. We love you guys.
Thank you very much.